My name is Dr. Ethan Greenwell. I'm 60 years old, and for more than 3 decades, I've worked with patients who believed stroke came without warning. But here's the truth most people never hear. The body almost always warns you first. The problem is, those warnings are quiet. A few years ago, a retired school teacher in her early 70s sat across from me. She wasn't in pain. She wasn't panicking. She simply described a strange moment, a sudden, heavy pulsing along the side of her neck while reaching for a glass of water. No dizziness, no headache, just a deep, rushing pressure that made her freeze. She told me it felt like something inside my head was trying to get my attention. What saved her that day wasn't medication. It wasn't luck. It was understanding, because what she felt wasn't random. It wasn't stress, and it certainly wasn't just aging. Science has shown for decades that the neck is one of the brain's earliest warning systems. Inside this small area lives a powerful network of pressure sensors, what we call baroreceptors, designed to monitor blood pressure every second of your life. When pressure rises too fast, these sensors send an urgent signal to the brainstem. Slow the heart, relax the vessels, protect the brain. But here's where age changes everything. After 60, blood vessels stiffen. Those sensors respond more slowly. And when regulation lags even for a few seconds, the brain becomes vulnerable. This is why so many older adults describe the same sensations. A sudden pounding in the neck, a wave of warmth rising to the face, a brief moment of lightheadedness when standing or turning the head. Most people ignore these signals. They shouldn't, because stroke doesn't usually begin with collapse. It begins with whispers. In this episode, I'm going to show you why a gentle, well-timed touch on one overlooked point in the neck can help calm the very system that keeps your brain alive, backed by real physiology, not folklore. I'll also explain when to use it, when not to, and why timing matters more than force. This isn't about replacing medical care. It's about understanding your body well enough to respond calmly before danger escalates. So if you're over 60 or love someone who is, stay with me, because the knowledge you're about to hear could change how you respond in the most critical seconds of your life. And it starts in a place most people never think to listen: the neck. For most of our lives, we think of the neck as nothing special. It holds the head up, it turns left and right. And when it feels tight or sore, we blame the pillow, stress, or a long day. But the neck is not just the neck. If the brain is the command center, then the neck is the main cable, the only highway carrying fresh blood, oxygen, and information straight to your mind every second. And when something begins to go wrong, this is often the first place the body speaks up. I can't tell you how many times I've heard the same story from patients in their 60s and 70s. It was just a strange pulsing. A warm wave came up my neck. My heartbeat suddenly felt louder on one side. They didn't fall. They didn't feel pain, so they ignored it. One gentleman, 71 years old, told me he felt a heavy pressure along the side of his neck while watching television. It passed in less than a minute. He laughed it off and said, "Doc, I'm just getting older." 3 weeks later, he was back in my office after a minor stroke. Here's the misunderstanding I want to gently clear up. Stroke rarely arrives without warning. What it does instead is whisper, and the neck is often where that whisper begins. This area isn't random. It's where the body carefully monitors the blood supply to the brain. When pressure changes too fast, when blood surges or drops, the neck senses it before the brain can feel pain or confusion. But many people dismiss these signals. They call it stress, they call it tension, they call it age, and sometimes they call it nothing at all. Let me ask you something. When was the last time your body tried to get your attention and you talked yourself out of listening? Because the lesson here isn't fear. The lesson is awareness. Your body is not fragile. It's intelligent. It speaks long before it breaks. And once you understand why the neck reacts first, you stop feeling helpless and start feeling prepared. In the next part, I'll show you what's actually inside this small area of the neck that makes it such a powerful early warning system, and why science has been studying it quietly for decades. Stay with me. There's a moment I've seen more times than I can count. It's quiet, it's ordinary, and most people don't realize how important it is. A woman in her early 70s once described it to me this way. She was standing in her kitchen, reaching for a glass of water. Nothing stressful, nothing unusual. Then suddenly, a heavy, rushing pressure along the side of her neck. Not pain, not dizziness, just a deep, uncomfortable surge that made her stop moving. She told me later, it felt like my body hit the pause button. That pause is everything, because in those first 30 seconds, the body is deciding something very important. Can I stabilize this on my own? Or do I lose control? What most people don't understand is that the body doesn't jump straight into crisis mode. It tries to correct itself first. Heart rate adjusts, blood vessels respond, signals move quickly between the neck, the brain, and the heart. But here's where things often go wrong. Instead of responding calmly, many people freeze, or they panic, or they tell themselves, just wait, it'll pass. I've watched patients sit with that pressure, holding their breath, staring into space, hoping the moment will disappear. Sometimes it does, sometimes it doesn't. And the difference often comes down to how those first seconds are handled. One gentleman once told me, "Doc, I didn't want to make a big deal out of nothing." What he didn't realize was that nothing rarely speaks this clearly. The body isn't dramatic. It doesn't shout right away. It gives you a window, a small one, to respond. Let me ask you this. When something feels strange in your body, do you lean in and listen, or do you rush to explain it away? Because those 30 seconds aren't about fear. They're about choice. The choice to breathe instead of tense. The choice to stay aware instead of frozen. The choice to help the body do what it's already trying to do, regain balance. And once you understand what's happening beneath the surface in that brief moment, you stop seeing these sensations as random. You start seeing them as signals. In the next part, I'm going to explain exactly what inside the neck is reacting so quickly, and why this system works faster than conscious thought, faster than medication, and even faster than fear. And when you understand that, those first 30 seconds will never feel the same again. Now, when people first hear about a point on the neck, I know what many of them think. They imagine something mystical, a pressure point, a trick passed down quietly from person to person. But what I'm talking about here is nothing like that. This is basic human physiology, the same biology your doctors study, test, and rely on in hospitals every day, inside the side of your neck, right where the main artery widens slightly. There's a small area called the carotid sinus. You don't need to remember the name. What matters is what it does. Think of it like a thermostat in your home. A thermostat doesn't create heat. It doesn't create cold. It simply notices when things drift out of balance and sends a signal to correct it. That's exactly what lives in the carotid sinus. Tiny pressure sensors, called baroreceptors, are constantly feeling the stretch of the blood vessel wall. Every heartbeat, every breath, every change in posture. When pressure rises too fast, these sensors don't panic. They report. The signal travels from the neck to the brainstem, then down to the heart and blood vessels. Slow down the heart, relax the vessels, stabilize the flow. All of this happens in seconds, without you thinking about it. You've felt this system at work before. When you stand up too quickly and feel a brief lightheadedness, that's the baroreceptors scrambling to catch up. When you feel your pulse race during an emotional moment, that's the system reacting to stress hormones. Most of the time, it works beautifully. But here's the mistake many people make. They hear about the neck and assume this is some kind of folk remedy or alternative trick, something outside of real medicine. It isn't. In hospitals, doctors actually test this reflex during cardiac evaluations. We rely on it when assessing heart rhythm and blood pressure stability. It's one of the body's most trusted safety systems. The lesson here is simple, but powerful. Your body already knows how to protect your brain. It has the tools built in. The problem isn't the system, it's that, with age, the signals don't always fire as quickly as they used to, and that's where understanding becomes crucial. In the next part, we'll talk about why this system slows down after 60, and why sensations that once passed unnoticed now feel louder, heavier, and harder to ignore. Once you understand that shift, you stop blaming yourself and start working with your body instead of against it. There's something I want to say gently, because it matters how we hear it. As we get older, the body doesn't suddenly fail. It slows, and there's a big difference. When we're younger, our blood vessels are flexible. They stretch and rebound easily, almost like new rubber bands. The pressure sensors in the neck, the baroreceptors, feel those changes clearly and respond fast. After 60, those vessels begin to stiffen, not dramatically, not overnight, just enough to change the timing. I often describe it like this. A young person's baroreceptors are like a new spring, quick to compress, quick to bounce back. An older person's receptors are more like a well-used spring, still working, still useful, just a little slower to respond, and that delay matters. One patient told me, "Doc, I stand up, and for a second the room feels distant." Another said, "When I get stressed, my face gets hot before my mind even catches up." These aren't signs of weakness. They're signs of lag. The signal is sent. The body responds, but the timing is off by a few seconds. And here's why this is important. The brain is extremely sensitive to sudden changes in blood pressure. Younger brains can tolerate brief spikes or dips without much trouble. Older brains, especially after 60, don't have the same margin. That's one reason stroke risk rises so sharply with age, not because people become fragile, but because the control system reacts more slowly to sudden demands. Let me ask you something. Have you ever noticed that your body now needs a moment? Just a moment to settle after movement or emotion. That moment is your body asking for cooperation. When people understand this, something shifts. They stop blaming themselves. They stop thinking, "What's wrong with me?" Nothing is wrong. Your system is still working. It just needs clearer signals and gentler timing. And that's where awareness becomes protection. In the next part, I'm going to show you how to recognize the exact moments when this system needs support. The early signs most people overlook, and why responding early makes all the difference. Because once you learn to read these signals, you stop being surprised by your body and start partnering with it. One of the hardest things for people to learn isn't how to respond. It's when. Most of us were raised to believe that if something is serious, it will be obvious, painful, dramatic, impossible to ignore. And if it's subtle, well, it must not matter. But the body doesn't work that way. The earliest warnings are often quiet, and they pass quickly. Let me describe the moments when this technique matters most. Not hours later, not when fear has already taken over, but in the small window when the body is asking for help. Patients often describe it as a sudden, unfamiliar pounding in the neck stronger than a normal pulse, almost as if the heartbeat has moved closer to the skin. Others notice a tightness or fullness just under the jaw, a feeling that something is pressing outward from the inside. Some feel a wave of warmth rising toward the face, not tied to embarrassment or exertion. And many experience a brief lightheadedness, a moment where the room feels distant when standing or turning the head. These moments are short. That's why they're easy to dismiss. But here's an important distinction. Muscle pain tends to linger. It changes when you move or massage the area. Vascular signals are different. They come on suddenly, feel internal, and fade once balance returns. One patient told me, "I almost ignored it because it was gone so fast." That's exactly why it mattered. The most common mistake I see is waiting. Waiting to see if it comes back. Waiting until it feels worse. Waiting until there's no doubt left. By then, the window has narrowed. There's a saying I often repeat in my practice. Early response beats emergency response. Not because we're trying to avoid help, but because we're giving the body a chance to correct itself before it's overwhelmed. Let me ask you something worth reflecting on. When your body gives you a quiet signal, do you honor it? Or do you demand that it shout before you listen? The lesson here is simple, but powerful. Recognizing early signs doesn't make you anxious. It makes you prepared. In the next part, I'll walk you through how to use this technique safely and gently. And just as importantly, what not to do, because with the body, force rarely helps, but timing almost always does. This is the part where I ask you to slow down with me, because when people hear that a simple touch can calm the system, their first instinct is often the wrong one. They think, if a little helps, more must help more. With the body, especially the nervous system, that's rarely true. Let's start with where. If you place your fingers on the side of your neck, just below the angle of the jaw, you'll feel a soft hollow, not the windpipe, not the large muscle, a gentle valley between them. That's the area we're talking about. Now, how much pressure? Imagine the pressure you'd use to wipe a tear from someone's face. That's it. Not pressing, not digging, just enough to feel the pulse beneath your fingers. One patient once told me, "I thought I had to really push." What happened? He felt dizzy, and that's exactly what we don't want. This system responds to stretch, not force. As for time, less is more. 3 to 5 seconds is plenty. You're sending a signal, not holding a switch down. While you do it, breathe slowly. Not because breathing is magic, but because it tells your body you're not in danger. It supports the message the neck is already sending. Now let's talk about common mistakes. Pressing hard, rubbing or massaging the area, repeating it again and again, or stimulating both sides of the neck at the same time that one is especially important to avoid. And there are people who should not try this without medical guidance. Those with known carotid artery disease, significant plaque buildup, or a history of vascular surgery in the neck. And one more thing needs to be said clearly. If someone experiences sudden weakness, trouble speaking, facial drooping, or loss of vision, this is not the moment for techniques. This is the moment to call emergency services immediately. Let me ask you this. When something feels powerful, do you respond with force or with respect? Because the lesson here is simple. The body doesn't need to be controlled. It needs to be listened to. In the final part, I'll explain how using this approach wisely can do more than calm a moment. It can actually help retrain the system over time, and how small daily habits either strengthen or undermine that protection. And that's where real confidence begins. Before we close, I want to leave you with a different way of looking at this. What we've talked about today isn't a trick. It isn't a shortcut. And it isn't something you use once and forget. When this technique is used at the right moment, something subtle but important happens inside the body. The nervous system remembers. You see, the reflexes that protect your brain aren't frozen in time. Even after 60, they can still adapt. They can still refine their timing. They can still learn. I've watched this in my patients. People who once felt frequent surges, sudden pounding in the neck, waves of heat, brief dizziness began noticing something after a few weeks. The episodes came less often. When they did appear, they passed more gently, not because the body got younger, but because the system got clearer signals. There's another layer to this that often goes unnoticed. When people understand what's happening inside them, fear softens. And when fear softens, the heart doesn't race as easily. Blood pressure stays steadier. The body stops bracing for danger that isn't there. Confidence becomes medicine. Let me ask you a quiet question. How often does worry about your health create the very stress your body is trying to escape? When we respond with calm instead of panic, we're not just settling the moment, we're reinforcing stability. And this is where this conversation opens into something even bigger. Because while this technique helps in the moment, there is a daily habit often done without thought that quietly stiffens the blood vessels supplying the brain over time. A habit many people blame on aging, but one that can be changed. When we address that, we don't just calm the storm, we prevent it from forming. The final lesson I want to leave you with is this. Control doesn't come from force, it comes from understanding. When you know how your body speaks, you stop fearing every sensation. You stop waiting for emergencies. You start living with awareness, steadiness, and trust. And that's what real health looks like, not a life without signals, but a life where you know how to respond to them. In our next conversation, we'll talk about that everyday habit and how changing it can protect your brain in ways most people never imagine. Until then, stay curious and stay kind to your body.